The MindHealth360 really aims to raise awareness amongst lay people about integrative mental health and functional medicine psychiatry, because there's very few people, I think, at the moment in the mainstream who know a lot about integrative mental health and functional medicine psychiatry, and yet there's a real dissatisfaction with the way mental health is treated at the moment. And so this website aims to do two things. One, to raise awareness about it. And second of all, it has a database of practitioners who practice integrative mental health and functional medicine psychiatry around the world. And if you haven't received an email yet about it, you will, so that it can actually connect patients with practitioners. As well as trying to raise awareness amongst lay people, what I'm trying to do also is create a community of practitioners so that you're not isolated and that you have a sort of network of support through the work that you're doing. Not all of you here are functional medicine psychiatrists or functional medicine practitioners, but a lot of you are. So this is the first dinner, which my excuse was that Dr. Olds was going to be here. And so NAD, which I first heard about through my friend Kat Toops, who is a functional medicine psychiatrist in the Bay Area, who Elizabeth knows quite well. And she said it's amazing for Alzheimer's and Parkinson's and addiction, and it's just this miracle thing. And I was like, okay, tell me more. And then I was talking to my friend Daniel Schmachtenberger, who runs Neurohacker in San Diego. And he was saying, you can get people off heroin in 10 days, and you can get people off benzos in 14 days. And it's just, it's incredible for addiction. It's, this miracle thing. And then my ex-husband emailed me the other day and said, well, what about this NAD thing for anti-aging? Have you heard of this? And I said, well, yes, I've heard of it. And he's like, it's supposed to be amazing for anti-aging. And that's his big thing. And so I was like, is there anything that NAD therapy can't do? And so I think if you look at it from the biochemical perspective, then NAD is one of the potential solutions that is being explored. So the guy who started Springfield Wellness Center is a guy called Professor Metier. So it's spelled Mystère, but it's Metier.
Right, it's French.
It's French, so I should be able to say that. And he has been doing a lot of incredible research into NAD and also practicing with incredibly good results. I think what I'll do is just hand it over to Tyson and listen to all the miraculous things that NAD therapy can do for us. So thank you.
Thank you.
Thank you.
So just real quick, Tyson Olds. I'm the medical director at Springfield Wellness Center, which is primarily an addiction detox treatment facility. We do aftercare as well, but our real focus is on getting the clients off the substance that they're actively addicted to. So I'm sure a lot of the people in this room are also wondering, I've heard of NAD maybe, but what's it all about for clinical use? So I'm hoping to touch on clinical applications, a little bit of background science, and really just a broad overview of what we do with NAD and maybe some theories as to how it does so many things, not just the one, like was kind of mentioned, that it seems to be this one molecule capable of doing so much. How is that possible? Sounds too good to be true, perhaps. So hopefully I can explain some of that. So real quick, I just wanted to say, the purpose of this talk is a broad overview of some of the biochemistry and clinical applications, like I mentioned, particularly in the area of mental health. I think that seems to be the general focus of the group. And I also wanted to just throw out there that really this knowledge is not intended to provide a training to go use NAD for a clinical practice, but there is a formal process to do that. And it's actually Dr. Richard Metier, and he is the current research director at Springfield Wellness Center, and he is the one who's really been practicing this for 18 years, and I can only take credit for a little over a year, so bear that in mind. But he does do formal training, and I added on there, from some of my discussions with him, someone wanted to get training closer to home rather than flying to Louisiana. It may be possible we could do an arrangement to bring the training here, so I'd be happy to facilitate that. So real quick, just what is NAD? There it is. That's the molecule in a picture form, and I'll show you the structures. Our nicotinamide, which you may have heard from, it's another name for vitamin B3, also called niacin. So there's a niacin precursor involved with NAD. There's an adenine group, and then the dinucleotide. So that's what NAD stands for, nicotinamide adenine dinucleotide. Much easier to just say NAD. So in a broad overview, this is my favorite slide. I was actually considering printing this slide out because it really shows you in a nutshell a lot about what NAD does. And I think this slide is one of the ones that can really help explain why it is that one molecule can help so many things. And so a lot of you may have heard from biochemistry about NAD and its role in the Krebs cycle and the electron transport chain. And really, if you haven't heard of those things, if you ever look into a biochemistry textbook, it's the part of the human body where we make energy in the form of ATP. That is the body's primary source of energy. And in that process, you'll see that NAD is a coenzyme used in nearly every reaction that takes place. And so clearly we know it has a vital role in just basic energy production. We also have found that it's involved heavily with the mechanisms of DNA repair, and that involves some of the PARP enzymes. We also know that it's involved with gene expression, and that's heavily activated through a lot of the sirtuin proteins. We also know that cell signaling, particularly including the immune system response, utilizes NAD and actually consumes it in the process. We know that through CD38 is one of the primary consumers of NAD. We also have evidence to support that NAD has a role as a neurotransmitter, and I will say some of that research is not the highest quality. So of the things listed on here, I would say that one would be the one that still needs a lot more research to support. It's also known as, or it's used in enzyme function. I've essentially talked about that with the electron transport chain and Krebs cycle. And then there's also some interesting evidence to show that there's a lot of pathways involved with biochemistry, with lots of arrows and a lot of different things that happen. So this bottom slide is kind of the summary of all of that, but there's evidence to show that NAD is associated with yet another enzyme that prevents telomeres, which is the ends of our DNAs, from shortening over time. And I remember from my medical school training that telomere shortening was related to one of these theories of aging, and that this idea that your cells have a finite number of times they can divide. Every time a cell replicates, your DNA is replicating. And when that happens, we know that these ends, called the telomeres, are often snipped off. And over time, those telomeres get shortened, and perhaps that's one of the multiple ways in which cells have their finite life cycle. So NAD helps prevent that shortening. If that's involved with the anti-aging aspect of it, I don't know. It may or may not be related to that. So where does NAD come from? How is it made? Ultimately the body needs to make it, so you don't get NAD directly from the diet itself. And we know that every cell in the body has NAD and utilizes it extensively, particularly in the mitochondria. And I believe all cells in the body, maybe with the exception of red blood cells, have mitochondria. And you can think of mitochondria as like the battery to your cells. So the main precursors, tryptophan, it's an amino acid found in protein, and then vitamin B3, also called niacin, which I mentioned, sometimes also called nicotinic acid or nicotinamide. And then some other precursors, which I'll explain a little further later, are nicotinamide riboside or nicotinamide mononucleotide, which is also called NMN. And so this is the biochemistry depicting what I just said in the last slide, if you like a visual a little better. So on the top left, you see tryptophan, that's the amino acid. Interestingly, that same amino acid is also a precursor for serotonin and also melatonin. But it's also used in the body's de novo process for making NAD. So you can see if you draw from left to right, that ultimately we make NAD through some modifications of tryptophan. And you'll see on the top there, nicotinic acid, which is the vitamin B3, is one of those precursors to producing that. But we've also discovered that we have a recycling process. So when NAD gets reduced, so NAD plus is the oxidized form of NAD, it gets converted, and ultimately that process breaks down, produces vitamin B3 again, other precursors, and this can be recycled through largely nicotinamide riboside and NMN, the nicotinamide mononucleotide, that can help the body remake NAD from those products. Interestingly, when the body's undergoing too much inflammation, we see that this pushes the body to take a lot of its tryptophan to make NAD, and as a result, we see less of that tryptophan being utilized for serotonin production, obviously a very important neurotransmitter, as well as melatonin. And in my non-science way of thinking about it, translation is, well, when you're really stressed out, don't you notice how your mood is affected and how your sleep is affected? And that's really what's happening, is this process is taking over to help you make NAD. So how do you raise NAD in the body? There's oral mechanisms, so you can take in some of these supplements you can find online, nicotinamide riboside, NMN I mentioned earlier, niacin, probably the one most commonly known, vitamin B3, and nicotinamide. The other option is really what we're doing at the Springfield Wellness Center that is giving NAD intravenously, and we know that that is hands down the most effective way to increase your NAD levels in the body. Unfortunately, NAD is not well absorbed through the digestive system, one of the main reasons why we give it through the IV. And then other things important to mention, we maintain our NAD levels that our body does have by reducing oxidative damage. Like I said, a lot of those inflammatory processes consume NAD. I'll also talk about how alcohol and some other substances will deplete NAD sources, and that's related to the addiction realm for this. And then I think I mentioned CD38 as being one of the primary consumers of NAD, and that is really the cell signaling molecule for getting your white blood cells to an infection site when it first detects that. And then ultimately increasing the synthesis of NAD, which I showed you that through the processes of how we synthesize NAD. A little bit more on CD38. It's a glycoprotein that's used by the immune system in cell adhesion, cell transduction, and ultimately calcium signaling. It ultimately helps the body send neutrophils to a site of inflammation, and that's the cascade. You remember immunochemistry or immunobiology, which is very complex. It's really the beginning of all of those processes that get the white blood cells, our infection-fighting cells, to the site of an infection. And when we decrease our CD38 counts, ultimately we have impaired immunity, so difficulty fighting off infection. So we want to have good CD38 function. So I think I mentioned this, but when inflammation is increased, CD38 goes up and it consumes NAD, so the net effect is you decrease your NAD levels in the body. This graph is showing mean CSF NAD levels, and CSF is a really good way of measuring ultimately brain levels of NAD. And the x-axis is showing alcohol intake, and this is people documenting how many drinks per day. So that bar on the left is a person who drinks no alcohol, in the middle is someone who drinks between 0 and 1 on average, and then on the right side you see the group of people who drank more than 1 per day. And so interestingly, we see that those who drink more alcohol have reduced levels of NAD. And it makes sense when we see the biochemistry, because that process of breaking down alcohol actually consumes NAD. Looking at CSF interleukin 6, that's another immunomodulator that's involved with getting or starting an inflammation cascade. And so it's a good biomarker for looking at how much inflammation is taking place in the body. And so same x-axis, looking at the alcohol intake, and really we're just showing here that with increased alcohol consumption, essentially we're demonstrating the neurotoxic effects of alcohol by demonstrating higher levels of inflammatory markers. So with increased alcohol, your interleukin 6 levels go up as well. So this is actually a study that was done at the Springfield Wellness Center and performed by one of our researchers. Her name's Dr. Susan Broom. And what she was looking at is craving scores. So really looking at a standardized scale that she used where it's, a patient comes in on day 0, we ask the patients, on a scale of 0 to 10, what is your level of cravings for the substance that you came in to get treated? And then we took measurements midway through our treatment course, which is currently mainly 10 days, but that's modified depending on why they're there for. But in this study, it was 10 days. So day 5, we see the levels going down from between 6 and 8 for the 2 groups down to about 2 on average. And then toward the end of our treatment, on the last day, really about 0. And so that's one of the real key highlights clinically of what we're seeing with NAD that makes it stand out.
Can I ask a quick question? I don't want to.
Yeah.
I know it's Q&A afterwards.
Sure.
But when you say they were in withdrawal, were they having a detox using agents to taper off the alcohol, or were they having an NAD-based withdrawal?
So they were more so having an NAD-based withdrawal. So we don't use any benzodiazepines. Actually, we use no controlled substances.
No
in our
Subutex, no
detox.
nothing.
No Subutex, no partial opiates or other opiates, no benzodiazepines, nothing but NAD and medications that are non-scheduled.
What about B vitamins?
We do use vitamins, so they're also supplements as part of our protocols.
Thank you.
And therapy as well?
And therapy, yeah, extensive therapy, and I can go into that.
Thanks.
No problem. So, okay, this next slide, another one of Dr. Broom's slides, and this is looking, further out. I showed you that last slide. It's really during the detox, during those 10 days of treatment. And so she followed these patients out, and it looks like from 12 to 20 months out, and just looking at what their cravings were down the road. And so we really see, those craving scores staying low between 1 and 2. And I think if you remember, the intake day was around 6 to 8, and so we can see we had 29 and 24, and then if you look here, of those we had 13 and 14. So roughly half of those patients from the same group followed up with us when we try to reach out to them. What the other half are doing, we don't know. And all of them were not getting NAD boosters. So we don't maintain a strict. We give them recommendations, but what they do, same in any clinical practice, patients often don't follow our best guidelines or recommendations. So this is just looking at broad overview. With and without extensive aftercare treatment, they're staying low, and that I think is a promising sign. This was the slide I was referring to earlier about alcohol metabolism, and so it's really showing you how the body breaks down alcohol. And there's really 2 key steps involved, and 2 enzymes, alcohol dehydrogenase and aldehyde dehydrogenase, that is involved with alcohol breakdown. But what I wanted to highlight here is that both of those enzymes use NAD to facilitate that reaction occurring. And so NAD in the oxidized form gets consumed in that process. So it kind of explains why we see that decreased NAD level in those who drink. And then this is just a comment added, clinical evidence demonstrated in our clinic that the IV NAD administration does help reduce withdrawal symptoms, and both metabolic and neuropsychiatric, in the form of cravings for those who come into us for alcohol reasons. So this is just going over, what are some of the benefits linked to, and I'm going to just put all the data here so I can see it. So really, I think some of the group here, especially the psychiatrists, know a lot about the glutamate and the GABA receptors in the brain. And in my understanding, GABA is kind of our sleepy, sedating neurotransmitter, and glutamate is really our, keep awake, keep conscious, and perform during the day neurotransmitter. And we know that alcohol works on the GABA system, which causes the sedation and the neurodepression that we see with it. And so, of course, what happens in these individuals who are alcohol dependent is that the brain wants to find balance, and so the glutamate receptors, those excitatory, keep you awake receptors in the brain, upregulate. And so what happens is when we remove the alcohol and we're no longer stimulating all the GABA receptors, the glutamate receptors, which are the keep you awake receptors, which have been upregulated to counter the alcohol that was once faced by the individual. Now the person's real anxious and they're neuroexcitatory. This is why we see in some patients who detox without assistance have seizures. One of our big concerns with alcohol detox. He put on here that elevating NAD levels, from our evidence, may help to reestablish the normal neuronal firing, so helping the GABA and glutamate system repair itself perhaps faster, and that's involved with, of course, the the mesolimbic reward pathway, and we see that through the form of these cravings getting improved in these patients. He also listed on here that we still need to know more about the pharmacokinetic properties of NAD, and this study was actually just performed by the Ross Grant from Australia, so we do have some new data on pharmacokinetics of NAD, which was done at the Springfield Wellness Center. So this next section of the talk is actually some research that was done by Susan Broom, one of our researchers, and this was done last year. And this was actually an add-on study that was performed during the pharmacokinetic study, which I just mentioned. And what she was interested in looking at was the effects of NAD on cognitive function. And I just pulled some highlight slides from her presentation that I thought would be useful. And so this is really what she was, she's wanting to look at different aspects of cognitive functioning. And one of the parameters or the testing modalities she pulled up was a test called the microcog. And I know I had not heard of this before, so I'm assuming not a lot of people have. But really what that test looks at is different tiers of cognitive function. And this pyramid here is just showing those tiers in a graphical form. And the lower level is looking at the specifics like attention, reasoning, memory, processing speed. And ultimately up the pyramid, we're looking at global cognitive function, just the overall level of cognitive, both functioning in terms of thinking, reasoning, but also proficiency. So that's going to look at the things like the processing, reaction time in a global view. And so here's one of her slides showing some data from the data that was collected during the study. Our goal was to get normal, healthy volunteers in this study, and the requirements were, I think, between the ages of 30 and 60, no history of substance use disorder, no active alcohol or controlled substance use, and generally overall healthy, and that was met by not having advanced cardiac disease, not having cancer diagnoses, not having chronic medical conditions. And so we had the group ultimately down to, we had 9 patients who were randomized to get NAD therapy, and the other part of the group was getting saline, so just normal saline. And I should mention that our NAD is given in normal saline, so really nobody knew which they were getting. And it looks like we had a total of 2 in that saline, at least in the data from these charts. And so what we're looking at is global cognitive function and global cognitive processing. And this is measured by the microcog, and then our scale scored on the left, so 0 to 100 as being, actually it looks like it's possible to go slightly above 100 based on this here. And interestingly, in both groups, we're looking at day 0 and day 6 in these 2 categories of cognitive functioning. In both groups, the normal saline or the control group and the NAD group, we both see a rise. So some of that is going to be explained by a 6-day gap in the same test being administered. So some of these patients are going to naturally remember a little bit more about the test because they've been prepared having done it once. And day 0 is going to be their baseline measurements, so having received no intervention, no saline, no NAD. And really why I want to highlight, or why I thought this slide to be useful, is that we see in the NAD group that the rise in cognitive function, both globally and in processing, is significantly, how should I say, it improved more than the saline group, and so much so that it was statistically significant, even with a group size this small. So at least showed us that there's something to be said about NAD and cognitive functioning, and especially in theoretically normal, healthy volunteers, which you would not expect to see as big of a difference, say, for example, on someone who is cognitively impaired, someone with Alzheimer's dementia, for example. It is one molecule, and how is it that it can help so many things? Well, it's related to its multiple roles in the human body. Some of those I highlighted were how we produce energy, making ATP, how we repair our DNA, those PARP enzymes, how genes are expressed, the sirtuin proteins which utilize NAD, and obviously in cell signaling I mentioned CD38, enzyme reactions, that's the Krebs cycle electron transport chain. Those are the biochemical, the science ways of looking at this. For me as a clinician, what I really care about is what patients receive benefits from this. And so, Springfield Wellness Center, we're focused primarily on addiction, mental health. And so we're seeing those benefits in the detox realm of helping patients successfully get off of these substances without the use of another controlled substance, without the use of Suboxone or benzodiazepines, and trying to focus more on diet, nutrition, and counseling work, and really not setting up for a path of having to take a medication for the rest of their life. And we've seen such success with it that we're inspired to share, and that's why Dr. Medier is training physicians trying to get awareness about NAD, and I'm trying to hopefully walk in his footsteps kind of early on in this. I know I didn't talk a whole lot about it, but because my focus is really on addiction. That's my area of focus, separate from chronic pain medicine. But I should say that we also use NAD for other forms of mental health exclusively, not just addiction. We have patients come in for depression, anxiety, and PTSD, and curious to know if NAD might help them, and we've seen benefits for all of these. I think a lot of you have heard of NAD in Parkinson's and Alzheimer's, and that there seems to be some role for that. We have had a lot of patients treated for those conditions, and I will say it does depend on how advanced the disease is. We've had patients coming in wheelchairs with really advanced Parkinson's and Alzheimer's where they don't know their family members' names, and we see benefits, but the level of benefits as compared to someone who's early on in their diagnosis with tremors, early onset tremors from their Parkinson's, we've seen those resolve. And we've actually, I just want to mention one of our Alzheimer's patients who, just to give you a case report on this, a gentleman who had a family history of Alzheimer's in his mother, who had developed Alzheimer's himself, was seeing a neurologist. I don't know if y'all are familiar with mini mental status exams. It's a screener for cognitive function, and his was 16, and that's severe cognitive impairments. The upper limit is 30. And so he'd heard about NAD through the grapevine. Somehow he knew Dr. Medier. I think they were fishing buddies. And so he said, well, maybe you want to check out NAD. We do it for addiction, but maybe it'll help you. And so he ends up coming in and doing the NAD therapy, and incredibly, his memory improved, and his mini mental status exam that I administered here just a few months ago was 29 out of 30. And when he went back to see his neurologist, who, by the way, he'd been followed by for 3 years, and who did much more than the mini mental. He did thorough cognitive testing, had a lot of nitty-gritty scientific stuff that I'm not that far out there. But he was well documented. And when he went back to see his neurologist kind of threw up his hands and said, I don't know what to make of this. And, I don't have a reason to see anymore. And he wasn't really interested in NAD, interestingly, but...
Was there anything else, any vitamins or like omega-3s or anything?
No. He comes in...
What about his lifestyle and the other lifestyle nutrition factors?
No other changes, exclusively IV NAD.
No.
Yes.
Wow,
And therapy and other.
That patient, he does not get therapy. No, not part
He
of his.
didn't want to do anything else.
He's kind of an old cowboy. He just wants to be on the fishing boat, and so he comes in. Yeah,
Just that.
he is good friends with the Mediers. So I should say Dr. Medier is the physician who's been doing this for 18 years. His wife is actually the pioneer who brought NAD therapy to the U.S. Her name's Paula Medier, and she is a counselor. And so whether he gets counseling on the side, I don't know, but I know he's not receiving that when I see him.
How do you make the NAD?
So the NAD is actually, my understanding is there's about 5 manufacturers of NAD raw material in the world. And the one that we acquired is actually in Japan. And so we import NAD in the raw form, and it's taken to a compounding pharmacy, which is also in Louisiana, and it's called Archway Apothecary. And they actually are the only pharmacy who has found a way to produce NAD for clinical use, both in the IV that we use, but also multiple supplements that we make. So we make subcutaneous NAD, patches, creams, melts that are dissolvable, oral melts, and what's the last one? Subcutaneous shots. And so they make all of that. And their process of making it does not involve lyophilization. And I don't fully know what all that means, except that it's a process where most producers of NAD utilize heat to make the reactions occur. And what's been shown is that the heat process actually breaks down some of the NAD, and it also makes it less stable. And so, in a nutshell, we've tested every one of the different manufacturers' NAD that Archway Apothecary has, and has found that the way that we're making it is by far the purest and the most stable. And so we test out to at least 3 months on all of our products, and we see 99.99% purity maintained throughout that span.
How do you test it in a person?
So there's a lot of different ways that the NAD has been measured, and I don't think anyone's stuck on just one as being the gold standard, since this has not been thoroughly studied just yet clinically. But I understand that the mass spec, that GC-LMS, gross chromatography mass spectrometry, is the main way that it's tested. And it looks like that measuring whole blood, as opposed to other forms of like looking at just plasma or just red blood cells, looking at the whole blood is probably the best way to do that. I should say this presentation is not a depiction of all of the available research. We have the blood levels of NAD. We've done that through the pharmacokinetic study, which I actually can happily share that data with you. As a scientist, I would actually speculate, because this has been shown in the microcog and other tests, not just with saline, that it wasn't the saline perhaps that caused that benefit. It's the practice effect, and it's because those patients who took this test on day 0 took the same exact test, same exact questions. They're briefed to it. We expect them to improve, and so 6 days later, retaking that same exact test, it can explain perhaps better than saline why those scores increased. But what was important to see from that slide was that the group that received the NAD, not only did they also improve, that was not the unexpected result, it was that they improved dramatically, or significantly, I should say, more than the group who just got the saline. And once again, that's a randomized study, so no one knew what they were getting. So that study, I believe every patient received 750 milligrams of NAD in 500 milliliters of normal saline. So for 5 days straight. So day 0 was baseline day, getting blood draws, and then 5 days of intervention. This is important to note because the human body makes NAD, so we're not giving anything foreign. For that reason we really can't have an allergic reaction, and we never have, and I presume we never will, with the exception of I will say some of our supplements, particularly the patches. There is an adhesive involved with that, so some patients will have a reaction to the adhesive. But NAD itself, if you didn't have it,
NAD patch.
There's an NAD patch, yes. So there's an 8-hour. It's actually a device. It's an FDA-approved device that we use, and it's basically a battery that once it's put on the skin, it creates a salt bridge. It activates the battery, and there's a 4-hour option, and an 8-hour option. And so we put a known amount of NAD on this patch, and we know it's going to diffuse over that length of time through the skin. It's pretty cool technology.
Are you guys collecting all your data, for every single patient and looking at what they're coming in for and then measuring them, because that would be super useful to see.
But Dr. Medier is, he's the research director currently. 50 to 75% of our patients agree to participate in the research. And so for every one of those patients, we're getting their blood levels of NAD, and we're establishing those baselines. And so we're seeing before, after, and some of them who will agree to give us another blood sample when they come for a booster, for example, we get those after effects, and so we can see, are their levels going back to baseline, or are they staying elevated? What we showed in that pharmacokinetic study, which pharmacokinetics is really looking at what the body does to the drug, as opposed to pharmacodynamics, where we're seeing what does the drug do to the body. And so we wanted to see, is this cleared? Is this effect, are we raising NAD, and is it just going right back to baseline in a couple of days? Are we peeing it out? And so what we showed in that study was that the NAD levels stay up. So less than 3% is being excreted. So this is very unlike B vitamins. Well, B vitamins are cleared rapidly through the urine, and that's why, for sure in functional medicine, you got to constantly take in these B vitamins, vitamin C, others as well, the ones that are not fat soluble, because we're constantly clearing them in our urine. at least according to our pharmacokinetic study.
And are there any studies that are specifically being done on the depression, anxiety, and PTSD component?
So, we don't have any known study. I'm not aware of any studies that looked at just those groups. It's really not the most common subsets that come in. But I will say we do see a substantial number of those patients, and it's usually a comorbidity. With the addiction comes those. We're tending to focus on the addiction, but because we're seeing this repeatedly, these depression, PTSD, per patient report, not an objective test or research, but per patient report, are all improving. So we're certainly excited about it. I'll also mention, because everyone wants to know about more studies. What else do you got? So Dr. Medier, I mentioned, is doing the study looking at blood levels of NAD over time and with the infusion. We also have a retrospective study coming out that's looking at patients, a much larger group of patients, follow up on how are they doing, post-addiction, are they still sober, are they still in recovery or not? And that's one of the things that I'm myself doing research on, is starting another, this is going to be a prospective study, taking in new patients who've never received NAD therapy. And my goal is to follow them up on a monthly basis, looking at lifestyle, looking at depression, mood, quality of life factors, legal issues, all of the things that encompass a lot of patients who suffer from addiction, the things that they get the sequela from, and following those over 24 months with a monthly survey, and then also a once every 6 month nail test to look at, are they really sober, because sometimes they want to tell us what we want to hear. And so we're going to confirm that through some objective studies. I'm also, actually just wrote a report on which one of this? We had a patient who actually did our detox program, and he also suffered from PTSD. He went back home. He lived in Oklahoma. He did not follow our aftercare recommendations to much of any level, unfortunately. And he relapsed back on alcohol, and at his own home actually went under detox. He had a major stroke, a hemorrhagic stroke as a complication, most likely from his blood pressure issues from that. And he ended up getting treated for that. Came into our clinic, and I actually thought it was right after the stroke, because his cognitive function, I knew this guy from the year prior, and it was very bad. He had a lot of an aphasia symptom. He didn't know who I was. He didn't remember me. And I actually went ahead and did the mini mental status exam to just get a baseline for him. And his score was actually also 16 at baseline. And it turned out it had been a couple months since he'd had the stroke. And so his symptoms were fairly stable. And we did another 6 days of IV NAD therapy for him. And at the end of the 6th day, his score went from the 16 to a 22. And 1 month out, when I did a follow-up with him, it had gone up to a 29 out of 30. And I don't honestly know what to make of that. I'm still kind of putting my mind around why it is that we saw such a dramatic improvement in his symptoms. But it's telling me this NAD is, maybe it really is too good to be true.
We'll all be getting it. So I'm thinking, did you bring me any? That's fine.
My own theory as to what we're doing with NAD is that NAD itself is not curing something. It's not treating an addiction. It's not making depression go away. But what it is doing is it's facilitating the body to do its own work. And we know that because NAD is so critical in how we produce energy, and ATP. And so my own theory is that what we're doing is we're giving a person who's undergoing stress for multiple reasons, whether it be depression, PTSD, inflammation caused by substances. We know that the withdrawal process is intensely energy consuming, which is why we often don't see people complete it. We see them relapse over and over. And so I think what we're seeing with the NAD therapy is really we're giving the body something that it needs to produce the energy to combat the loss of energy from the depression, from the withdrawal symptoms off of opiates, alcohol, other substances. And so we're basically enabling the body to do its own job. We're not doing the job, the body's doing the job. NAD, which we all make, we would not be living if we did not make it, is really the key ingredient. I think, obviously boosting that when we have things that depleted, those I mentioned, as well as other forms of inflammation, like an infection, cancer, other sources, are all going to be the things we're competing with. And so when we can give NAD through the IV, we seem to see more things being benefited than, I don't know. It's hard to wrap my mind around, honestly, but we're even seeing more than what I've listed here. A lot of guys looking at this in cardiac medicine, in diabetic treatment, we're seeing decreased insulin requirements. I truly think it's the human body doing the work, and NAD is just a facilitator, really.